what is a Brazilian tummy tuck? Hi, JJ. On the live on Tuesday, can you please talk about the Brazilian tummy tuck? What it is, how it differs from a normal tummy tuck, and whether it's safe, and your opinion of it, please. Yes. Okay. Well, my opinion of a Brazilian tummy tuck is it's something that, to be honest, I've had to. It's not something that I've seen much in the medical world. It's something more in the sort of online world of people talking about it and using the term. Now, I'm a big fan of using terms for things. We have a thing where we have a buddy scheme where patients thinking of having surgery, we put them in touch with someone who's already had the surgery. We have a satisfaction guarantee where we refund the consultation fee if we haven't been helpful. So I'm a big fan of giving things names. Say we got our, eternally grateful if you have surgery with us. We'll you will see your friend without charging a consultation fee. Giving names to stuff, and this is, and it's sort of marketing, really. Giving names to things, sort of the buddy scheme, put you in touch with someone who's previously had surgery. I think a lot of doctors would do that, to be honest with you. They may not call it the buddy scheme, they do it anyway. But it's a bit like, oh wow, they have a buddy scheme, that sounds really good. And in a way you could call that marketing, or it's just letting people know what we do. For me, I think this Brazilian tummy tuck, from what I can see of it, is a little bit marketing, really. I look at what people say it is, and one of the things they talk about is limited undermining. When you do a tummy tuck, you have to undermine all the way up to the rib cage, and they talk about just making a tunnel above the rectus muscles so you can repair the rectus muscles. I've been doing that for as long as I can remember, making that tunnel. I've been doing it for like 10 years. I haven't. So when I see people talk about it, they say, oh, normally a tummy tuck, you widely undermine all the upper skin flap, you widely undermine it to the sides. I've never widely undermined it to the sides. I've only created a little tunnel century so that you can pull that down, and you have to undermine a tunnel century in order to repair the rectus muscles. And so does that mean I've been doing a Brazilian tummy tuck all this time? And I could, I don't know. So that's one thing that they say that it does, as opposed to a normal tummy tuck. But in my experience, a normal tummy tuck, you don't widely undermine. It's very old fashioned to widely undermine. I don't think people have been widely undermining for a long time. I don't know. Maybe people are widely undermining. But the other thing they talk about is liposuction. It's, again, going about the marketing thing, liposculpture. People like this word liposculpture instead of liposuction. It's still sticking a bit of metal in which sucks fat out. You can call it liposculpture. Okay. Sculpturing the fat, sucking the fat to sculpt it. So liposucking, and they're talking about liposucking the whole abdomen, so liposucking the upper fat. And that is not something that I do. So that is, I guess, something different about a Brazilian tummy tuck if they are liposucking the upper flap. And that is something traditionally we've often been worried about. There's a question later about thinning that upper flap. We were always worried about the blood supply of that upper flap. Now they're saying because they're limiting the undermining, they can still do liposuction to the upper flap without affecting the blood supply and get good healing. It's one of those things where I think if people have got good experience of that and it works, then that's fine. Personally, I don't liposuck that upper flap. I liposuck to the sides. So they're talking about liposuction, sucking the whole abdomen. So combining a tummy tuck with liposuction, again, is something that's been around for many years. It's not anything particularly new. So it's just sort of giving a name to a combination of procedures that maybe a lot of people are doing anyway. Limited undermining and liposucking to contour the flanks and the hips is something that certainly I've been doing for a long time. The difference is I don't liposuck the upper flap, which might be something that could distinguish it. So that is something that could distinguish it, but the rest of it is, I'm not seeing an awful lot of things to differentiate it from a normal tummy tuck. Whether it's safe in your opinion, well, I wouldn't do it. I wouldn't liposuck the upper flap, but then maybe I'm just conservative. One of the things about plastic surgery is that you need people to sort of push the boundaries. If you're always safe, then maybe you're not doing enough. So, but the problem with people pushing the boundaries, then they might get wound healing problems. But it's good that people are pushing the boundaries, and it might be that it will become standard to liposuck the upper flap. Um, if these people can show that it's deemed to be safe, but I'm not one of them. I'm one of the sort of I'm not the flag bearer at the front to check whether it's all okay. I'm doing the sort of thing that we've been doing for a long time, which is not liposucking the upper flap. So maybe it'll in time become acceptable, but I don't do it. The other thing I think they talk about is you're not using drains because of the limited undermining. Again, as I say, I've been using limited undermining and quilting sutures for a long time. I still do use drains. I just worry about seroma. It's not a big deal, seroma, but it's a bit of a nuisance and it's not something I really see. So, it's like I don't really want to, even if it's a small risk of seroma, I'd rather not have that. Um, and again, normal tummy tuck, people doing normal tummy tucks has not been using drains for quite a while now. So I don't really see it as a tangible difference in the tummy tuck world. I think people are often looking for, oh, I do this technique, which is totally different to everybody else. First of all, if that's the case, you've got to think, why does no one else do it if it's so great? And secondly, you might come around and think, actually, it's not widely different to whatever else is doing. It's a bit like vasor liposuction. You know, sometimes it's touted as being something wildly different that can get wildly different results. When in fact, when you're in it, you look at it, it's sort of not that different. The results you can get compared to traditional sort of power assisted liposuction. Um, so I think for me, I think it's a bit of a name thing, but that's because I don't really. It's not a name that I tout about that I do it. Maybe I should say I do a Brazilian tummy tuck, because I do the narrow undermining and sculpt the hips and the flanks. But that's where it is for me. I'm not big on it, but some people are. So yeah, do your research, look at the results of the surgeon, and if they're good, then go for it.